हमारे देश में ना रेगुलेशन इतना नहीं है, तो लोग हर तरह के अलग अलग नाम पे दवाइयाँ बेच देते हैं। जो भी इमेज आपकी रेटिना तक जा रही है, उस हर इमेज को लेंस के थ्रू होके पास होना है।
नई ज़िंदगी मिलती है बहुत पेशेंट्स को, स्पेशली जिनके मैच्योर कैटरेक्ट्स हो जाते हैं, बहुत पक जाते हैं मोतिये।
यस, उस जमाने में ये सच्चाई भी थी कि पकने की वेट किया जाता था, परंतु
A lot of patients have fear about undergoing cataract surgery. उन्हें इतना डर लगता है कि उससे उनकी आई साइट चली ना जाए।
देखिए, यदि आप फ्लाइट में जाते हैं, यदि आप घर में किचन में खाना बनाते हैं, यदि आप सड़क पे पैदल चलते हैं, टू व्हीलर चलाते हैं, इन सबसे ज़्यादा सेफ है कैटरेक्ट सर्जरी कराना।
You look at the patient's eye or what the patient wants.
खासकर अगर पेशेंट उन प्रीमियम ऑयल पे जा रहा है जिसमें ट्राइफोकल टेक्नोलॉजी है, तो हम ये देखते हैं कि क्या पेशेंट की कॉर्निया की कंडीशन कैसी है, उसकी रेटिना की कंडीशन कैसी है, ऑप्टिक नर्व कैसी है।
Do you think it has also helped you to reduce your surgical time for cataract surgery?
My surgical time, which used to be around 12 to 15 minutes, has gone down to now 7 to 8 minutes. कि यदि आपकी आंख में धुंधलापन आ रहा है और रोशनी नहीं बढ़ रही और आप जांच कराना चाहते हैं ना, और आंख में मोतियाबिंद निकलते हैं, मैं कहूँगा बधाई हो, मोतिया हुआ है। क्योंकि
Hello and welcome to another exciting episode of the Eye Conversations with me, your host, Dr. Sheetal Brar, Director, ProSight Eye Hospital, Chandigarh. So our today's celebrity is going to be Dr. Rakesh Gupta, who is a highly successful practitioner and a renowned ophthalmologist, founder and director of Shreya Eye Center, Delhi. Welcome to Eye Conversations, Dr. Rakesh.
thank you, Dr. Sheetal, and thank you, your team, for inviting me on this wonderful journey of Eye Conversations, and it's a pleasure for me to be part of this program.
It's entirely our pleasure to have you on the show, Dr. Rakesh.
Thanks a lot.
How did you start this journey? So, would you like to tell us about your academic journey and your professional journey?
So yeah, Dr. Sheetal, actually I come from a very humble background and from a lower middle class family, and my parents were not so educated, but they supported me, very well to study. And since childhood I had two qualities of like I was very fond of doing art, and I was passionate in technological work during my school days also. So to be honest, I was planning to be engineer because I was good in studies, but I cleared both I would say medical entrance as well as engineering entrance, and then because of peer pressure I was pushed to come towards medical field.
Oh, okay.
But I realized that when I come to I joined my MBBS, I really started enjoying that, and then I realized that ophthalmology is a field where my childhood hobby of doing a fine work, artistic work can be utilized, and that is how I opted for ophthalmology. And thankfully it turned out to be a wonderful journey since then. I never looked back. It has been now 25 years. I have been into ophthalmology, and it became my passion since then. And I must say that was the best decision of my life, because 3 years spent at LV Prasad Eye Institute at that time gave me immense confidence. My surgical skills, my clinical skills, they were brushed completely, and I turned out to be a very different person, not only as an ophthalmologist. And then I joined Eye Care Hospital. It's a good hospital, charitable hospital institute in Noida, as head of the cornea and refractive department. And then I decided, I was missing something. I thought I must start on my own. I realized my patients are satisfied, and my results were, satisfying my patients. In fact, my friends encouraged to go further, though I was lacking money. but I took initiative. My father supported me, my parents supported me, and I started my small OT in 2008. And gradually, I kept doing good work. My patients were, quite happy, and I realized that I can go further. And gradually, I started taking, those steps which probably, as a single first generation practitioner, it is very difficult to take. And because that was a big decision, I realized once you take a big step, big risk, and you get a big gain, it gives you a perspective that risk is just a perspective, and there have been ups and downs, but today I can say whatever I thought I could achieve in my life at this age, I feel I have been successfully able to achieve that.
Definitely it was as you can say that it started with a struggle, but since you were so determined and you were intelligent, you had good skill set, so that has taken you where you are today. So indeed it's a very inspirational journey that you have had, and it would definitely inspire the younger generation, the fellows and the students who are just uh, who are just starting off with ophthalmology, and knowing your journey, that you come from a humble background and you did struggle a bit in your initial years, and how your parents helped and how your determination took you to this level where you are today, is truly inspirational and very, very impressive.
Thank you, Dr. Sheetal. How
Mhm.
you take your decisions, whether you are taking a decision to make money or you're taking a decision to achieve a level. So to be honest, I was very confused at that time. So there were, one of my friend, he pushed me, and he suggested me, Rakesh, go ahead and do this investment. I was in two minds because I was quite happy. It was a very, if I tell, it was a very cool life for me. Any lazy patient I was taking to other center, and I was sleeping with very good sleep, because there is no expense on my part. I was simply saving money. I was keeping my patient satisfied. But then I realized, that on insistence of my friends also, that I had to take a decision if I want to achieve a level which I was dreaming of.
Yeah,
And no pain no gain is a, it's a old saying. So I took that decision. It was a heavy investment at that point of time, I must
certainly.
say.
Yeah.
And in fact, through this program, I would like to tell those youngsters who are actually aspiring to be ophthalmologists, or who are doing post graduation, senior residency, fellowship. During your journey, many times you will feel, in fact, your seniors will tell you stories. They sometimes may look scary, that there is so much of investment, they are in debt, and this technology, companies will take away all the money, you are not saving anything. All these a negative conversation goes on. It happened to me also. Many of my people, many of my friends who were owning that machine, they told me it's a very risky decision. People in my in vicinity, they realized that I am giving a service at a level of LASIK. 10 years back it was a big thing. So that means it's a big hospital. The perspective of my hospital
Patients.
in
Yeah, I
patient's
can.
mind,
Yeah.
that really became positive. And I actually, to my all contemporaries in my area, my level went one level up.
Yeah.
So I went, I thought that my competition has gone down now. So these are the benefits which I realized after taking that step. And all those people moving from East Delhi, because I'm working in East Delhi, which is not so posh area. I
Okay.
mean, posh part of Delhi NCR is supposed to be GK, South Delhi, Gurgaon, Noida. So yeah, it's very true. I mean, I took my share of risk,
Yeah.
and thankfully, with God's grace, those risks actually paid me.
Absolutely. And we are also living in a very informed world, right? So you mentioned that now you have the latest technologies. You have the Zemer C8 for femtocataracts, for clear refractive lenticle surgery. So patients nowadays are very aware. They search for the hospital, its facilities, and where all they can get the advanced facilities. So that's, I think, a great step that you have taken for yourself and for your center to get the best technology. And with this you will definitely benefit your patients and also your center. So congratulations for that.
And thank you so much, Dr. Sheetal.
So now that you have access to the flax or the femto laser assisted cataract surgery, which is the most advanced thing in cataract surgery right now, but let's get down to the most basic thing, which is cataract itself. So, for the benefit of our audience, can you please explain in simple terms what a cataract is and how it can affect the vision of an individual?
So I think there are two part of this question. Cataract for ophthalmology is an hub around everything which revolves. तो क्या होता है जब जो भी हम देख रहे हैं, मैं आपकी तरफ देख रहा हूँ या आप इस प्रोग्राम को देख रहे हैं, जो भी इमेज आपकी रेटिना तक जा रही है उस हर इमेज को लेंस के थ्रू होके पास होना है. और लोग सोचते हैं कि कैटरेक्ट एक कोई ऐसी बड़ी बीमारी है. तो मैं पहली बात कहना चाहूँगा, कैटरेक्ट स्टीरॉइड्स का सेवन अगर कुछ लोग मतलब इंजुडिशियस यूज़ करते हैं, बहुत लंबे समय तक करते हैं, या कभी कभी कुछ बीमारियों में दिया भी जाता है, तो भी कैटरेक्ट बन सकता है. लेकिन दोस्तों मैं एक बात बताना चाहूँगा, मोतियाबिंद आँखों की एक ऐसी बीमारी है जो कि मैं कहूँगा कि यदि आपकी आँख में धुंधलापन आ रहा है और रोशनी नहीं बढ़ रही और आप जांच कराना चाहते हैं ना, और आँख में मोतियाबिंद निकलता है, मैं कहूँगा बधाई हो, मोतिया हुआ है. क्योंकि मोतियाबिंद का ऑपरेशन करके पूरी तरह विजन इंप्रूव की जा सकती है. यदि आपको मोतियाबिंद नहीं है तो जो भी बीमारी होगी उससे ज़्यादा खतरनाक होगी. ग्लोकोमा हो सकता है, रेटिनोपैथी हो सकती है, नर्व में इफेक्ट हो सकता है, और कुछ भी हो सकता है, रेटिनल डिटैचमेंट हो सकती है. अगर कैटरेक्ट है तो बधाई हो, मोतिया हुआ है.
डॉक्टर राकेश, दैट ब्रिंग्स मी टू द नेक्स्ट क्वेश्चन कि काला मोतिया और सफ़ेद मोतिया ये दोनों डिफरेंट प्रॉब्लम्स हैं और लोग उसको मोतिया ही समझते हैं. सो आप इसके बारे में भी बता सकते हैं कि हाउ बोथ द डिजीजेस आर डिफरेंट एंड क्यों कैटरेक्ट को सफ़ेद मोतिया कहा जाता है और क्यों ग्लाकोमा को काला मोतिया कहा जाता है.
बहुत अच्छा इंटरेस्टिंग सवाल पूछा आपने डॉक्टर शीतल. तो दोस्तों देखिए, सफ़ेद मोतिया एक मैं कहूँगा जैसे रसगुल्ला, रस भी है गोल भी है. तो सफ़ेद मोतिया में सफ़ेदी भी है, मोतिया भी है. और काला मोतिया इज़ लाइक गुलाब जामुन है, ना गुलाब है ना जामुन है. उसमें ना कुछ काला है ना मोतिया. एक्चुअली उसमें क्या हो रहा है, काला शब्द क्यों जोड़ा गया है इसमें डॉक्टर शीतल, बुरे से. जैसे हम देखते हैं कभी भी हम देवता और राक्षस को देखते हैं, राक्षस सारे काले कपड़ों में होते हैं. तो मुझे लगता है जब ये नाम रखे गए थे, प्रोबेबली साइंस इतनी इवॉल्व नहीं हुई थी, सोचा नहीं जाता था, तो मोतियाबिंद तो कहा जाता था. क्योंकि अगर आप देखें पुराने ज़माने, आज से 70-80 साल पहले, जब मोतियाबिंद के ऑपरेशन होते थे, धर्मशालाओं में होते थे, स्कूलों में होते थे, कैंप में, तो आप जब जाओ ऑपरेशन के बाद ना, जगह जगह सफ़ेद सफ़ेद मोती पड़े होते थे. तो इसलिए सफ़ेद मोतिया नाम तो बड़ा वाजिब नाम है जो रखा गया है. लेकिन क्योंकि मोतियाबिंद एक कॉमन बीमारी थी, सभी को कहीं ना कहीं होती थी, गाँव में अस्पतालों में ऑपरेशन होते रहते थे, तो काला मोतिया जो बीमारी है जब इसका देखा गया, क्योंकि काला मोतिया में क्या है, दो बातें खतरनाक है. एक तो उसमें लक्षण नहीं होते, दूसरा इससे खोई हुई रोशनी वापस नहीं आती. तो ये दोनों बातों को जोड़ दे तो कालापन, काला मीन्स बुराई, सफ़ेद मीन्स अच्छाई, काला मीन्स बुराई. तो इस बुराई को डिनोट करता है काला रंग. और मोतिया शब्द इसलिए मेरे ख्याल जोड़ा गया डॉक्टर शीतल, क्योंकि उसमें मोतियाबिंद एक बीमारी होती थी. सफ़ेद मोतिया मीन्स की अच्छा है, रोशनी वापस आ जाएगी, और शायद काला मोतिया मीन्स की रोशनी वापस नहीं आएगी. So that is how I interpret these two names.
The vision loss in glaucoma is irreversible, whereas the vision loss in cataract is reversible. जब आप कैटरेक्ट निकाल देते हैं, नया लेंस डाल देते हैं, तो आपकी विजन वापस आ जाती है कैटरेक्ट में, लेकिन ग्लाकोमा में वो विजन वापस नहीं आ सकती. इसलिए इट्स वेरी इंपॉर्टेंट कि अगर आपको ग्लाकोमा का शक है या सस्पिशन है तो आपको प्रॉपर जांच करवानी चाहिए और उसका ट्रीटमेंट लेना चाहिए कि आपकी सो दैट आपकी बची हुई विजन बच सके और आगे विजन लॉस होने से हम उसको प्रिवेंट कर सके.
एग्जैक्टली. सो डॉक्टर शीतल, दर्शकों मैं बताना चाहूँगा कि इसके अलावा देखा जाता है यदि आपकी एक ना डायगोनल विजुअल फ्लक्चुएशन होता है, खुश होने की जरूरत नहीं है. हाँ, कुछ समय हम मजे ले सकते हैं, लेकिन आपको जाके जांच करानी चाहिए और निकट भविष्य में आपको ऑपरेशन की जरूरत आ रही है. काश ऐसा
या
हो
फिर
सकता
सर्जरी ही उसका परमानेंट सोल्यूशन है.
काश ऐसा हो सकता है डॉक्टर शीतल, बट हम सब जानते हैं
जी
कि ये एक खुशफहमी है. कुछ लोगों को हमारी एक अगेन एक ना पर्सपेक्टिव होता है पब्लिक में. कुछ लोग जैसे ऑपरेशन का नाम आता है तो उनका या तो बीपी हाई हो जाता है या टेंशन हो जाती है, और फिर वो एक ना एस्केप रूट ढूंढते हैं. और जब एस्केप रूट ढूंढते हैं तो मिलता है, क्योंकि हमारे देश में ना रेगुलेशन उतना नहीं है, तो लोग हर तरह के अलग अलग नाम पे दवाइयाँ बेच देते हैं.
नई जिंदगी मिलती है बहुत पेशेंट्स को, स्पेशली जिनके मैच्योर कैटरेक्ट्स हो जाते हैं, बहुत पक जाते हैं मोतिये. फॉर देम इट्स अ न्यू साइट एंड अ न्यू लाइफ आफ्टर कैटरेक्ट सर्जरी.
बिल्कुल डॉक्टर शीतल, जैसे आपने पकने वाली बात कही, ये यस, उस जमाने में ये सच्चाई भी थी कि पकने की वेट किया जाता था. परंतु सौभाग्य से हमारे पूरे वर्ल्ड में ऑफ्थेल्मोलॉजी में बहुत इनोवेशंस हुई हैं, थैंक्स टू दोज इंजीनियर्स, दोज टेक्नोलॉजी.
सो डॉक्टर राकेश, यू टॉक्ड अबाउट द रिकवरी.
परंतु अगर आपकी विजन रिकवरी अच्छी हो गई है तो आपको बेड रेस्ट की जरूरत नहीं है.
That's so heartening because what I've seen is that a lot of patients have fear about undergoing cataract surgery.
Yeah.
उन्हें इतना डर लगता है कि इससे उनकी आई साइट चली ना जाए या फिर कुछ अनटूवर्ड ना हो जाए.
यदि कोई पेशेंट डरता है तो मैं डॉक्टर शीतल अपने पेशेंट को 2-3 बातें बोलता हूँ। देखिए, यदि आप फ्लाइट में जाते हैं, यदि आप घर में किचन में खाना बनाते हैं, यदि आप सड़क पे पैदल चलते हैं, टू व्हीलर चलाते हैं, इन सबसे ज़्यादा सेफ है कैटरेक्ट सर्जरी कराना। 100% सेफ्टी की उम्मीद मत करिएगा। कभी कभी ये पेशेंट आते हैं कि 100% सेफ्टी बताइए या गारंटी दीजिए। तो देखिए, मेरा मानना है कि गारंटी और 100% सेफ्टी 2 लोग दे सकते हैं, या तो भगवान या बेईमान। क्यों आप ये इंसिस्ट कर रहे हैं डॉक्टर को कि आप गारंटी दीजिए? डॉक्टर आपके लिए अच्छा करने की कोशिश करेगा और वो खुद चाहेगा बेस्ट रिजल्ट आए, लेकिन ये गारंटी और 100% सेफ्टी की बातों में मत फंसा करिए। हाँ, सेफ्टी 99.9%, और सेफ्टी केवल ऑपरेशन पे डिपेंड नहीं करती दोस्तों। आपकी अपनी बॉडी की बायोकेमिस्ट्री कैसी है, मेटाबॉलिक कंट्रोल कैसा है, और आपकी आँख की सिचुएशन क्या है। लेकिन यदि आपने समय रहते ऑपरेशन करा लिया तो कॉम्प्लिकेशन रेट आजकल मैं कहूँगा लेस देन 0.1% है।
You rightly said, Dr. Rakesh, that if the patients present at a very late stage or with complicated cataracts, like very mature cataracts, intumescent cataracts, बहुत पक जाते हैं जब बीम होती है, and they have complications like secondary glaucoma, आंख का pressure बढ़ जाता है, the bags get weak. So definitely these are only the cases where we have risks of having any kind of intraoperative complications. But as long as it's a straightforward case, most of the times it's an uncomplicated surgery and very comfortable recovery also for patient.
Exactly, I totally agree, Dr. Sheetal, because समय रहते ऑपरेशन करा लेते हैं. You know, any surgery done at a right time will give you right results at a right time and with minimal complications. ये जो पेशेंट वेट करते हैं ना, किसी भी कारण से प्रोक्रेस्टिनेट करते हैं, कुछ पेशेंट्स को डर रहता है सर्जरी का, कुछ पेशेंट्स ये सोचते हैं सर्जरी जितनी डिले की जाए उतनी अच्छी है. देखिए, कुछ ऑपरेशंस के लिए ये कहना ठीक है कि ऑपरेशन डिले करना अच्छा रहता है, लेकिन कैटरेक्ट सर्जरी एक ऐसी सर्जरी है, एनी सर्जरी विच इज़ फंक्शनल रीस्टोरिंग सर्जरी. फॉर एग्जाम्पल, मैं मानता हूँ नी ट्रांसप्लांट भी उस कैटेगरी में आता है कि आपके अगर आप चलना शुरू कर देते हैं आपकी लाइफस्टाइल अच्छी हो जाती है. ऐसे ही आई कैटरेक्ट सर्जरी है कि यदि आपकी विजन अच्छी होती है आपकी लाइफस्टाइल अच्छी होती है, और लाइफस्टाइल के साथ आपका हैप्पीनेस क्वोशिएंट बढ़ता है, आपकी वर्केबिलिटी बढ़ती है, आपकी जो फैमिली को सपोर्ट करने की कैपेसिटी बढ़ती है. बहुत सारे इसके ना सोशल एडवांटेजेस होते हैं जो हम डिस्कशन में नहीं लाते हैं, और लोग कैटरेक्ट सर्जरी कर करके अपने आप को परेशान करते रहते हैं डिले कर करके. तो उस पेशेंट का जो फीडबैक था, इट्स अ वेरी आई ओपनिंग फैक्ट. इवन आई नेवर इमेजिन कि इतना फर्क पड़ता है किसी को.
Definitely, you said it so rightly that it should be done in time, and especially when the patient starts feeling the symptoms of it, like the early blurring, the early glaring when they are driving. So these are the early signs, and they should come for their ophthalmologist for eye checkup and get it done at the earliest, so that you can prevent the complications of cataract surgery done at a later stage.
Exactly.
Right?
And not only this, to get the advantages at a right age. As I said कि 52 की एज पे जो एडवांटेज मिलना शुरू होता है, 63 पे that person started driving again, including night driving. So not only complications, there are many more advantages also.
So Dr. Rakesh, nowadays we have an ample of choices for intraocular lenses. How do you really decide the lens for your patient? What are your deciding factors? Do you look at the patient's eye or what the patient wants? How do you really decide that?
So yeah, Dr. Sheetal, it's a very interesting question, and you know, I think this is I would say a situation with every ophthalmologist these days.
Yeah.
When a patient comes, you know, and they actually expect us to guide them which lens is good for them, especially those patients who have no issue with expenditure, who are ready to spend on good technology and good lens. So the way I look at it, मोटे तौर पे 3 कैटेगरी होती हैं. इसके बीच में एडवांस मोनोफोकल और ईडॉफ में थोड़ा सा सेपरेशन होता है. तो 4 कैटेगरी मान लेते हैं: मोनोफोकल, एडवांस मोनोफोकल, ईडॉफ और ट्राइफोकल लेंस. बाकी जो होते हैं वो ब्रांडिंग होते हैं, अलग अलग कंपनी के अपने अपने ब्रांड्स होते हैं. तो कभी कभी जब पेशेंट हॉस्पिटल में आता है वो परेशान हो जाते हैं, बहुत लंबी लिस्ट है. तो दोस्तों, वो लंबी लिस्ट होती है वो आपके फ़ायदे के लिए, क्योंकि आपके बजट को देखते हुए अलग अलग कंपनी के लेंसेज बनाए अवेलेबल होते हैं. कुछ कंपनीज़ हैं जो कॉस्ट इफेक्टिव लेंस बनाती हैं, कुछ कंपनीज़ हैं जो एक ब्रांडेड कंपनीज होती हैं जिनके लेंस वर्ल्ड वाइड अवेलेबल होते हैं. ऐसे लेंसेज जो होते हैं वो थोड़ा एक्सपेंडिचर उसमें ज़्यादा होता है, दे आर लिटिल कॉस्टली, बट उनके रिजल्ट्स थोड़े से ज़्यादा प्रिडिक्टेबल होते हैं और सेफ्टी ज़्यादा होती है. लेकिन जब कौन सा लेंस एडवाइस करना है, डॉक्टर शीतल, जैसे आपका जो क्वेश्चन है उस पर वापस आते हैं. तो पहली बात, पेशेंट की आँख की कंडीशन कैसी है, खासकर अगर पेशेंट उन प्रीमियम आयल पे जा रहा है जिसमें ट्राइफोकल टेक्नोलॉजी है. तो हम ये देखते हैं कि क्या पेशेंट की कॉर्निया की कंडीशन कैसी है, उसकी रेटिना की कंडीशन कैसी है, ऑप्टिक नर्व कैसी है. अगर आँख ओवरऑल नॉर्मल है तो उसके बाद हम देखते हैं कि पेशेंट की लाइफस्टाइल requirements क्या
Yeah.
है, which is the most
Very
important part.
important. Yes.
There are patients who have more indoor activities. जो हम मैं मानता हूँ 90% लोग ऐसे होते हैं जो कि इंडोर एक्टिविटीज़ करते हैं, कंप्यूटर पे काम कर रहे हैं, चाहे IT प्रोफेशनल्स हैं, CA हैं, इवन डॉक्टर्स हैं या बैंकर्स हैं, दे ऑल आर वर्किंग ऑन लैपटॉप्स होल डे. तो उनकी जो एक्टिविटी वो नियर डोमिनेंट हो गई है. और नियर डोमिनेंट होने से क्या है कि अब हमें उनकी रिक्वायरमेंट पूरी करने के बिना चश्मे के उनको नज़दीक का अच्छा दिखे. और ये अगर आप पूछेंगे किसी से भी तो उनकी रिक्वायरमेंट नेचुरल है कि भाई बिना चश्मे के दिख जाए तो बहुत अच्छी बात है. ओनली आपको एक चीज़ याद रखनी है कि नाइट ड्राइविंग के समय आपको थोड़ा सा एडजस्ट करना है विथ हेलोज अराउंड द लाइट. हालांकि अगर आप गूगल करेंगे आपको ना कोई भी ट्राइफोकल टेक्नोलॉजी के साथ या मल्टीफोकल जो पहले पुरानी टेक्नोलॉजी अवेलेबल थी उसके साथ ना ग्लेयर हेलो बहुत हाईलाइटेड है. तो दोस्तों आज से जब 20-25 साल पहले जब मल्टीफोकल लेंस आए थे जो एक्चुअली बाईफोकल हुआ करते थे उसमें ग्लेयर हेलो काफ़ी हुआ करते थे. लेकिन टेक्नोलॉजी बहुत इवॉल्व हो गई है. लेकिन एक बात डॉक्टर शीतल आप भी एग्री करेंगे कि जब भी कोई टेक्नोलॉजी नहीं आती है ना उस पर R&D होती है और उसी के साइड इफेक्ट्स पब्लिश हो जाते हैं जो आगे चलते रहते हैं. जो एडवांसमेंट के साथ वो साइड इफेक्ट्स कम होते हैं वो हम मिस करते हैं. तो देखा जाए तो नई टेक्नोलॉजी में वो काफ़ी कम हो गया है. और 2-3 महीने बाद मेरे जितने पेशेंट्स हैं मैं मेल्स में भी करता हूँ, इवन नाइट ड्राइविंग वालों को भी मैंने डाले हैं.
You need to prepare the mind of the patient. And what I typically tell the patient is that, see, if you want complete spectacle independence, you need a trifocal lens.
Exactly.
And the lens is made in such a way that there are rings on the surface, because without that, we cannot make you see for all distances without glasses. So that's the design of the lens. And after the procedure, you're going to see some amount of halos and glares, which will be tolerable, because with the modern lenses, with the fine vision trifocal, and also some of the other lenses, the technology has actually improved a lot, and the incidence of halos and glares has significantly come down. So, and I also tell them that if you see halos and glares, that's actually a good thing, and it means that the lens is working.
Exactly.
So you will expect to see these halos and glares, which gradually will reduce. So you have to stay positive and tell yourself this is fine, this is expected, and I'm healing, I'm getting better. And you will see that in few weeks of time these halos will automatically disappear, or actually your brain is going to adapt beautifully to these optical phenomena, and you'll be just fine after few weeks.
Exactly. And one obstacle which I feel, Dr. Sheetal, that I think you belong to a generation of ophthalmologists who is accepting technology very well.
Yeah.
But still there are many senior respected ophthalmologists who have worked with those older generation of bifocal lenses, and because of that experience they still have hesitation. So I think not only younger generation, sometimes we'll end up bringing confidence in the younger generation. Yeah. I think our senior ophthalmologists also need to understand that this technology has improved so far. And not only technology, I say that there is a paradigm shift in the lifestyle of people. As I said, our life is near dominant. Even with doctors, if you see, we are either working in the surgical theatre or in the OPD. Yes. We hardly need to see distance. And near dominant activity, anybody who has near dominant life, they have a desire to be without glasses. There is no other choice. The practical choice is to go for trifocal lens. So I always tell my patients, see, you have two choices.
Actually, we tell the patients about halos and glares, but really when I take the feedback from them, that what is the severity of these halos and glare, most of them say that they are pretty acceptable and minimal. So it's not such a big problem with the modern trifocal lenses, and especially with the fine vision trifocal that has a copodize technology, so that reduces the halos and glare, because the rings, the surface of the rings is made very smooth. So the incidence and severity has actually come down. So in my personal experience, I've seen that especially with this trifocal, the incidence of troublesome halos and glare is definitely does not exist at all.
Exactly. And I'd like to add one more point. Any patient who has a cataract, they always have some element of subcapsular cataract. So their brain is already neuroadapted for those halos and glare.
Yeah.
If you see, there is subcapsular cataract, so they always have some starburst, some scattering of light, and to some extent halos. So I realized if we are operating on a patient who has a significant cataract, these are the patients who actually don't even notice those halos and glare, because their brain is already adapted to this. They were already driving at night with that cataract in their eyes. Yeah. And they have learned to manage with that. So I share the same experience as you have told. When I ask patient in retrospect, how are you feeling about glare halos? They always say, डॉक्टर साहब पहले तो हमें बहुत रोशनी फैलती थी, अभी तो नहीं फैलती.
अब कम है.
कम है. In fact,
Exactly.
they are more comfortable while driving.
True.
So there are some aspects which, if you think, it becomes true. Sometimes we do trifocal lenses with clear lens extraction as a refractive lens exchange. So yeah, those patients, they do feel, but I feel if we inform them
True.
beforehand, then
That's
they don't
the key.
feel.
Yes.
But some doctors, I've seen some, if they were not counseled properly or counseling was done in a hurry and patient misses that part of halo glare, and when they notice, it needs more chair time to explain them that it is I would say a side effect but a good effect of trifocal lens because of those rings. And overall, again, I emphasize that if it is giving you independence from glasses for reading, it's a big advantage for that small trade-off. And one advantage which I have realized, with this lens is that there is a very good tolerance of this lens for larger rexes. Sometimes your rexes, if it runs away or it is larger than normal
Exactly.
rexes, that C-loop, IOLs, they tend to pop up. And sometimes,
Exactly.
we see that, lens is captured in the rexis margin.
Yeah.
And that also decenters the lens. In this lens design, once all four haptics are in the bag, even whatever is the shape of rexis or size of rexis, I believe that, excellent, this centration remains excellent, and which is very important for any trifocal lens, because slightest of decentration will increase that halo and glare part at night driving. And during daytime, this gives excellent vision. At night time, minimal glare and halo. In fact, some patients have told me, doctor, have you put trifocal lens because I'm not seeing glare and halo.
So rightly said, and in my experience also, I've seen that these lenses are extremely stable in the bag, and I think there has been a study in AIMS recently by Dr. Rakesh Sinha, where they've actually seen and evaluated the distance between the optic and the capsular bag and compared with different lenses, and they've found that with this particular design, which is the double C loop, this distance between the lens and the posterior capsule is the minimum, which
exactly.
Which shows that it sticks to the bag well, and it sticks to the bag well, and it is a very stable position in the bag, which does not rotate. And because of that, the toric stability is also excellent. And I've been using these lenses, the toric lenses and the trifocal lenses, even for a very small amount of cylinder, as minimum as a 0.5 diopters, just because the rotational stability is excellent.
Yes, exactly. And one more advantage, Dr. Sheetal, is that, in traditional C-loop design, if you are putting toric lens, you can only rotate in one direction.
Yes.
So if there is slight offshoot, you have to go and completely rotate by 180 degree. In this lens, there is an option of rotating in both the direction. And once it is rotated well, there is no need to do anything else. And post surgery, the rotational surprise is almost negligible.
So Dr. Rakesh, other than the trifocals which you are already using, how is your experience with the enhanced monofocal lenses, and where do you really use these lenses, in what kind of patients?
So my answer will be 100% yes. It gives you very good vision for distance. But nowadays, as I said, our life is becoming indoor. More and more activities are indoor, and it is near dominant. And there are certain patients, where we actually, in spite of our best, liking, we cannot put trifocal lenses. For example, if patient has diabetic retinopathy or macular degeneration, or say advanced glaucoma, or patient has a history of retinal detachment, there are certain conditions where we cannot put trifocal lenses, but we want to give minimal dependency on the glasses. Now, what is that excellent intermediate vision? दोस्तों, जैसे बहुत सारे काम लेडीज करती हैं किचन में, आप सब्जी बना रही है, सब्जी काट रही है आप, और कुछ लोग जो खासकर दूर करके मोबाइल वगैरह देखते हैं, उनको चश्मे की जरूरत लगभग खत्म हो जाती है. तो ये इस एडवांस मोनोफोकल लेंस का बहुत अच्छा फायदा है.
Exactly. Even in my experience, the ISOPure enhanced monofocal lenses from BVI have given me excellent results when my patients did not want a trifocal for some reason, either financial or functional, but they still wanted a good intermediate and near vision. So I typically use these lenses and do a little mini monovision. So I keep the non-dominant eye myopic at 0.5 target, and the results are excellent. No halo glare, no compromise on distance visual acuity, excellent contrast sensitivity, and excellent intermediate vision. And many of these patients are able to see N6 and N8 without any glasses.
I totally agree with you.
So, Dr. Rakesh, I've seen some of your YouTube videos, and the videos show that you can do your cataract surgery with both the hands with the same amount of skill, and also any kind of complex eye surgery. You have a very special skill set, which is the acquired ambidexterity. And I think this is a skill set that every surgeon wants to have and is needed when we do cataract surgery or glaucoma surgery or retina surgery. Any kind of eye surgery needs a good ambidexterity. So, how did you practice that, and how do you and what suggestions would you like to give to our young eye surgeons to improve on their ambidexterity?
So yeah, Dr. Sheetal, I must say there is a very interesting story behind this, and to be honest, this is a serendipity actually. Uh, I'm a proud father of 3 daughters, and I've got twin daughters who are younger. I mean, who are 13 years now in 7th class. So in 2018, one of my twin daughters is a lefty. She uses her left hand
Okay.
naturally. So it happened by chance, I was playing badminton with her. So she was trying to play with right hand. She realized that because I was using right hand. So I said, no, you continue with your left hand. I will play with the left hand. And I realized that after a few sessions, my game improved with the left hand. Then, I was playing table tennis after 1 year, and I realized I was playing table tennis with the left hand, and gradually this skill also improved. So, and by then, I was going through a small story about which actually inspired me. I'll share this story also. That once a reporter went to a place where elephants are kept. एक महावत से उसने पूछा कि ये इतना बड़ा हाथी हो गया है और इतनी पतली सी चेन से बंधा हुआ है इतने पेड़ के साथ, ये तोड़ता क्यों नहीं इसको? सो उस महावत ने बड़ी अच्छी बात बोली कि जब छोटा था ना उसने बहुत कोशिश की थी, पैर उसका छिल जाता था, अब वो इतना डर गया, उसको ताकत बढ़ गई है, पर उसको पता ही नहीं कि वो कर सकता है, तोड़ सकता है, तो क्योंकि उसको पता नहीं, ही इज नॉट ट्राइंग इट. तो दैट लवली स्टोरी इंस्पायर्ड मी. So this shows that कि some boundaries are fixed during childhood. कुछ लिमिट्स बचपन में बंध जाती हैं, बड़े होके वो लिमिट्स को एक्चुअली वी कैन पुश दोज लिमिट्स, वी सिंपली डोंट ट्राई. क्योंकि मैं अपने डॉटर के साथ खेलते खेलते मुझे लगा था कि मैं कर सकता हूँ. सो कोविड केम, दैट टाइम वी वर नॉट मीटिंग पीपल, सर्जरीज वर लेस, and so I started doing several things. For example, I am fond of drawing, so I started doing drawing with my left hand. I started eating with my left hand. I started combing and brushing, several things. So gradually I started trying surgery with my left hand. And I thought, okay, my right hand is a trainer and my left hand is a fellow. So I started doing some practice surgeries with my left hand and then actual surgeries. And the moment I realized it is not going well, my right hand will take over. So it took me almost 1.5 years, and gradually I started doing phaco first, then I started doing tunnel making, then I started doing capsulotomy, and now I realize I have completely my left hand has completely taken over every function with same dexterity. And that is why I call it acquired ambidexterity, because some people feel that ambidexterity is a natural talent. It cannot be acquired.
Yeah.
So I am a live example of that if you are determined and if you keep trying and trying, ambidexterity can be acquired. And when this happened, I started doing right eye with the right hand and left eye with the left hand, sitting at the same 12 o'clock position. So I don't need to rotate to, generally surgeons have to move to.
Yeah.
And now what I'm doing is I'm simply looking at where is the, steep axis. For example, if it is 45 degree in the right eye, so you cannot do supranasal surgery with the right hand in the right eye.
Yeah.
With the left hand, I'm able to do that. In the left eye, I'm doing with the right eye. So practically, there are so many advantages, especially in the cataract surgery.
Yeah.
I feel every surgeon should give a try to it. I have talked to my neurologist friends. They say not everybody can, but there are a good number of people who if try to train their left hand, it is quite possible. And when I was doing this, I evolved this new technology of dual tunnel ambidextrous phaco, which is very good tool for posterior polar cataracts. You don't need to do hydrodissection. You don't need to rotate the cataract. You simply make 2 tunnels, make one trench with the right hand, make other trench with the left hand. So it is practically 4 quadrants without
Yeah.
rotating the nucleus.
Wow.
You crack them, take out 2 pieces from the right hand, take out other 2 halves from the left hand, and without doing hydrodissection, without rotating, the full cataract is out. So
Amazing.
this has really came in last 5 years I have evolved this, and now I want to inspire to train new younger surgeons. But I know there is a inertia,
Learning curve also.
there is inertia,
Yes.
there is a learning curve. But if you start doing this, it is definitely going to give your surgical skills or bring your surgical skills at a next level, and my creativity actually has gone up. So I believe somewhere it has helped my creative thinking also. So I believe if you try to use your left hand to some extent, and gradually you increase the efficiency of that, probably it is going to give you a newer perspective in your thinking process also. Probably your creativity is going to improve, and if you're lefty and you started using your right hand, it will improve your logical half of the brain. I'm not sure, I'm not a neurologist, but this is my personal experience.
Do you think it has also helped you to reduce your surgical time for cataract surgery?
Absolutely. But my surgical time, which used to be around 12 to 15 minutes, has gone down to now 7 to 8 minutes.
Wonderful.
And especially if there is a complicated cataract, it doesn't make me need me to think twice. My confidence level has gone up. There was a time when every surgeon, when there is a complication happens suddenly, there is a phase of palpitation or anxiety or sweating. Sometimes it happens. So you go into panic sometimes. It has never happened in last 4 years with me.
Amazing. So also, I think when you have a complication like a PCR, you have to be using your left hand all the time to push visco or to do vitrectomy or
Exactly.
something. So Dr. Rakesh, you have two centers, busy centers, and I can only imagine how you must be shuffling between the two centers, doing surgeries, OPDs, consultations.
So yeah, Dr. Sheetal, I mean, for any doctor, it's very tough to spare time for your hobbies, families, and work-life balance is a big challenge. But I must say, with God's grace, I have been able to manage my work-life balance very successfully. So I started doing all those activities, and now I've decided that my OPD hours are limited. I'm doing surgeries. Obviously, surgeries. There is no capping on that from my side. So I've hired more ophthalmologists. So I would say that I've given chance to my juniors to work with me. It is helping more families. I've increased my number of staff in the hospital, number of counselors. So I've shared my those work which I feel is not important for me. For example, there was a time when I used to do biometry myself. Now all investigations are being done by my optometrist. My all patients are being seen by my colleagues. I've asked them, please get your workup done there, and I will be operating. I have kept 2 slabs of consultation, so that because some patients want to surgery from me, but they can show to my colleagues whose consultation fees is less and my consultation is higher, so that I can give quality time to those patients who needs my personal attention. And at the same time, if I've decided I take twice a week break for my golf, I have spared 2 hours in a week for my other hobbies like painting, sketching. My younger daughters are in 7th, so they need my time. So I try to give time to their needs also. Though it is challenging, but I believe busy people have more time. If you value your times, yeah, I have cut down my time on the social media. That was a major portion which was taking away my time. So once I started my hobbies like golf, so I realized I have to cut down on somewhere. So social media time, which is I was spending earlier, I've reduced my time on social media. So this is how I have been managing. But yeah, because I've started second center recently, which has picked up well, and I need to give time there also. So I believe in entrepreneurship there are two phases. One thing is lifestyle entrepreneurship. One other thing is business entrepreneurship. And I read somewhere in a book that I feel that this phases automatically change, and I think we should keep changing because change is always good. So for last 2 years I was more into lifestyle entrepreneurship when I was playing golf. After COVID era was gone, and
I think you have worked your ways around very well, and this is why you are able to make time for your hobbies and passions and also keep a very good work life balance. This is so inspiring and so important for everyone to learn. How do you manage your systems, your workflow, delegating work, and giving more opportunity to juniors and doctors and fellow colleagues. So they also get more opportunity to see more patients, and this improves their opportunities as well. And at the same time, you're also able to make time for yourself and for your hobbies. I think this is something which needs to be learned from you. And I have personally learned this because I am facing a lot of difficulties at times managing my time with my family, work, travel, conferences, etc. So, thank you for your wonderful suggestions.
No, thank you.
Dr. Rakesh, we spoke about a lot of things: cataracts, your experiences with patients, lens technologies, femtolasers, etc. etc. Now, we have to have some fun. So, are you ready for some fun and quirky questions?
Oh, I think I'm ready.
Great. So, the answers need to be only in a single word, single phrase, or a single sentence.
Oh, that's going to be interesting. Let me see.
Let's go ahead then. So, first question: if you were not an ophthalmologist, what career would you have chosen?
Uh, I think ophthalmology is my passion, but yeah, artist. Being artist has been my childhood dream. I would have preferred to be artist.
What kind of artist?
Painting, sketching.
Nice. What's the most unusual or funny question a patient has ever asked you?
Ah, difficult question, but I think several questions. One, doctor, because I am presbyopic, I use reading glasses. So, doctor, why are you wearing glasses when you're suggesting us LASIK, or when you are, removing glasses for everyone?
Yeah.
Why you are still wearing glasses?
And what do you say?
So I say, because I'm presbyopic, I'm not myopic, so I'm compelled to use it. I would love to remove my glasses, but I'm evaluating the current technologies, and to me, there is no perfect technology to remove presbyopia, maintaining my need of doing surgeries and profession.
That's a very good response, I must say.
Thank you.
What's your guilty pleasure snack during your long holidays?
Ah, aloo parathas.
Parathas. That's my breakfast.
So and I love parathas. Whenever I feel I'm tired, I am exhausted, and I ask my mother to cook paratha with her own hands, and she's a lovely cook. And when she make parathas, it is a stress buster for me also.
Parathas are my favorites too.
Oh,
So we have something common in between us.
that's great. Great to know actually.
So if you could have dinner with any historical figure, who it would be and why?
So I think Leonardo da Vinci.
That's surely the artist side of you speaking.
Yeah, maybe yeah. You're right.
What's the one piece of advice you would like to give to your younger self when you were starting your career?
Start playing golf early.
Wow, I like that.
I actually miss that. I feel I should have started playing golf early.
Which eye condition do you think would make an interesting movie plot?
I think it's glaucoma is a once a disease which can be interesting movie plot.
Yes.
Because it gradually steals it steals away your field of vision, and over a period of 3 hours, it's easy to show how a glaucomatous patient is losing the vision, and it can be turned into I would say comedy movie, to even a scary movie, to a suspense movie, because the way glaucomatous patients they lose their vision and their lifestyle changes, it is going to be a very good plot for a movie.
That was a very thoughtful response. If you had to explain ophthalmology to a 5-year-old, how would you do it?
Oh, it's a very tough question, but I think
Since you have small
yeah.
daughters.
So ophthalmology is all about looking into eyes, to cure the eyes, and to, I would say, to show what I am thinking about you, because eyes speak. So बेटा, जिन आंखों से आप इस सुंदर दुनिया को देख रहे हो और जिस तरह से देख रहे हो, हर उम्र में इस आंखों को ऐसे बनाए रखी जाए, ये मेरा पेशा है.
बहुत खूब. बहुत ही बढ़िया.
Thank you.
What's the quirkiest thing you have seen in an operation room? आपने इतने operations किए हैं. So कुछ भी funny, quirky thing, experience you had with a patient?
Yeah, it once I was operating on a patient, and I asked my assistant कि उसे वहाँ से उठाओ, and patient simply stood up, and with a drape and everything on this thing, and this actually happened with me.
Patient stood up.
I think the patient understood that कि उठ जाओ, And suddenly I said, what happened? Everything is going up through the microscope. Patient stood up. The patient had had banged into the microscope, and my assistant were holding them, and you know
You were operating on the
I
patient.
was operating on the patient, and asked my assistant something, and patient understood that I'm asking the patient to get up, and she suddenly got up. Her head,
I hope there were no damages.
not no damages. There was some bruise on the forehead, but I completed the surgery. Luckily, there was no complication because it was just a beginning of surgery, but there was a small bruise on the head. So I realized how important it is to
Not
converse,
speak. Yes.
not to speak, and what to speak, how to speak.
Exactly.
So because our patients are all aware, and they are conscious.
Yeah.
So sometimes when we are speaking,
Mm.
so that made me learn that when you're talking about it, always keep in mind whatever you're talking,
Yeah.
patient's ears are also listening, and his or her perception is going to be different.
Exactly.
And they may respond in a very unexpected way.
Yeah, because our mind is everywhere. We are doing the surgery also, we are talking to the assistant, we are thinking about OPD, because after a level, surgery becomes a spinal thing, right?
Spinal thing.
But for the patient, his entire energy is focused on the surgeon's voice.
Exactly. And
So he or she is going to take every command very seriously. And even if you are talking to someone else, they would probably think that they're talking to you, and then they would respond.
and it has happened many times, but that was most quirkiest thing which has happened to me. But sometimes for example, if you ask anybody कि AC बंद कर दें, तो patient will say नहीं नहीं मुझे AC बंद नहीं कराना. They think that we are talking to them.
Yeah.
And they sometimes so I think my team has gradually learned that doctor will be doing talking to the assistant. So आपको जब पूछेंगे तो ही आप जवाब देना.
Yeah.
So it's a part of normal counseling just before the surgery. But yeah, sometimes these funny things happen.
All right. So the last question. If you could have a superpower related to vision, what would it be?
To be ability to see that whatever patients I have operated, I would like to see the smile on their faces, wherever they are, in watch form they are, whether they are here or abroad. That supervision will help me in realizing what difference I have made to their life.
Oh, that's so touchy and emotional. As a surgeon, we always want to see our patients happy, and we always wish that wherever they are, they should enjoy good vision and always remember you as a good doctor.
That is
it.
Absolutely.
So, Dr. Rakesh, it was so lovely to have you here on Eye Conversations. How has been your experience being on this podcast?
So, Dr. Sheetal, I must say it's a very interesting and good concept, because it is giving an opportunity to our juniors, to patients, to public at large, to our seniors, to listen what ophthalmology is about, what eye disease is about, from directly eye doctor speaking to eye doctor. It's a wonderful
True.
opportunity.
Yeah.
For public also, because Google sometimes gives information which patients don't interpret rightly.
Yeah.
So our this conversation is going to give them good insight about eye diseases, and how they should take up this surgical advice about how to remove fear of surgeries. It's a wonderful concept.
Thank you so much for appreciating our concept of Eye Conversations, and thanks again for making time from your very busy schedule to be with us on this Sunday evening and sharing about your work, your life, your passions. It was so wonderful having you here with us on this show. Thank you so much again.
Thank you, Dr. Sheetal. Pleasure is mutual, and I'm really feeling great to be here with you. Thank you.
So friends, with this, we come to the end of this very exciting and insightful Eye Conversations podcast, which we had with Dr. Rakesh Gupta today. If you like our content, please subscribe to our YouTube channel and follow us on Facebook and Instagram. Also, put in your comments what do you think about this program and how can we improve. Thank you so much for joining in today, and we look forward to meeting you again with a new celebrity in the new episode of the Eye Conversations. Stay tuned, take care, and goodbye.